Hello YouTube, I'm Dr. Fox. Today, I'm talking about HIV and pregnancy. Human immunodeficiency virus or HIV is a virus which can lead to AIDS or acquired immunodeficiency syndrome. You get it if bodily fluids from a person who already has the virus enter your system. Generally, this means blood or semen. Once the virus is inside you, it attacks your immune system, so you are less protected against infections and diseases like pneumonia and cancer. It can take a long time for HIV to turn into AIDS, even several years. It becomes AIDS after a certain number of the cells in your immune system have been destroyed. Some people don't even know they are HIV positive until they have AIDS, which is why it is very important to be tested. At the moment, HIV cannot be cured and there is no vaccine against it. However, it can be treated with antiretroviral medicines and HIV positive people can stay healthy for a long time. Importantly, HIV positive people who are taking their medicines are also less likely to pass the infection to other people. Okay, question. Can you get pregnant if your partner or you are HIV positive? My answer is yes, you can. But we strongly recommend that you discuss it with a doctor or nurse before you start trying. If you are HIV positive, you must continue taking your antiretroviral medicines, as this will help stop you infecting your partner or your baby. If you haven't started taking antiretroviral therapy, we advise you to start now, even if you don't have any of the signs of HIV and you feel well. Remember to tell your doctor, nurse or pharmacist about your HIV status if you're planning to become pregnant. And once you know you're pregnant, they will not tell anyone else, and as some anti-HIV medicines can harm unborn babies, they may need to change your prescriptions. If your male partner is HIV positive, he also has to take certain very important precautions before you start trying for a baby. Firstly, he must have been taking antiretroviral medicines for at least 3 months, probably 6. Secondly, he must have tests in the 2 months before you start trying, and both these tests must show that he has below detectable levels of the virus. If your partner cannot take antiretroviral therapy for any reason, then there is a 0.1% to 0.3% chance every time you have sex that he will infect you with the virus. In this case, some couples who want a baby choose not to have sex, but for the woman to become pregnant by artificial insemination, using sperm that has been cleaned by specialists or has come from a donor. You should also do all the things that non-HIV positive women do to make yourself as healthy as possible before you start trying to get pregnant, like eating good food, taking folic acid supplements, not drink alcohol, and not smoking or taking recreational drugs. We realize this sounds complicated and even difficult, but it is extremely important. Your nurse or doctor can talk you through it step by step and give you all the advice you need. Lastly, you should be aware that some people will criticize you if they know you or your partner is HIV positive but you are planning to start a family. You can ask your doctor for consulting about this. Okay, last question. If you are HIV positive, will your baby also be HIV positive? My answer is not necessarily. You can do a lot of things to reduce this risk. First, continue taking your antiretroviral drugs or start taking them if you have not yet done so. Even if you don't feel ill, discuss having a planned cesarean delivery with your doctor, as this may be safer for the baby. When your baby is born, don't breastfeed her, as the virus can be passed on in your milk. And be prepared for your baby to need treatment in the first year of her life. She'll be tested several times, and if necessary, she will have to take drugs for up to a month after she's born. Okay, thank you for watching. See you soon.